Obamacare once and for all. Marc Thiessen is a columnist for the Washington Post and Fox News contributor and a fellow at the American Enterprise Institute. Good to see you this morning, Marc.
Good to see you, Shannon.
Okay, so they have a lot of different coalitions to make happy. As you and I have discussed, they only had about 10 or 12 votes that they were short last time. But how do you pull in the conservatives you need, but also keep those moderates, the Tuesday group, happy? I see that Congressman Tom MacArthur, who's one of the co-founders of or co-chairs of the Tuesday group, who at one point said, I think they said they would not take any calls anymore from the Freedom Caucus. They were going to hang up on them if they called. He says now they have worked out some measures he thinks will bridge the gap. What could those be?
Sure. Well, first of all, thank God for Paul Ryan that he's not given up on this. If Republicans do not succeed in repealing Obamacare, they are going to face the wrath of their own base in the 2018 midterm elections. So this is something that just simply has to get done. They were really only 10 to 12 votes short last time around. It was a small number of people in this, as you described, the Tuesday group, which is sort of the centrist group, and it's a group of people in the Freedom Caucus. The problem is it's like squeezing a toothpaste tube with that's open on both ends. If you squeeze and make changes on one end, you lose people on the other, and vice versa. So they have to find a way to get the two sides together to keep all the toothpaste in the tube and pass this thing. The big issue is focused on the issue of covering people with pre-existing conditions and keeping premiums low. The Freedom Caucus wanted to get rid of something called essential health benefits, which is a requirement in Obamacare that you have to cover certain things, and something called a community rating, which is a complicated way of saying that in a particular area, everybody gets covered at the same price. You can't take it into consideration whether they have pre-existing conditions or not. If you get rid of those two things just without anything else to replace them, premiums are going to go up for older people, and people with pre-existing conditions are effectively going to lose their coverage. Because if, let's say you have cancer, and the law says you have to provide coverage to people with cancer, but you don't provide cancer treatment, you basically don't have your pre-existing condition covered. So they're coming up with a compromise, a solution to make sure that those people with pre-existing conditions get insurance. It's called high-risk pools, which means you got taxpayer-subsidized coverage for those people who are high risk, and also keeping the premiums low. And if they can do that, they can pass this thing.
Well, and some of this has been put in the context of allowing states to apply for waivers. If they can show they can meet some of those conditions, they can get rid of some of these Obamacare mandates. That was very appealing to the House Freedom Caucus, the more conservative folks. It worried the moderates. They were worried about that framework. But if it's the states that have to get the waiver and opt out and actually get approval from the federal government, do you think that framework will work for both ends of the toothpaste tube?
I think it will, because what it'll have to, the states, all the pre-existing conditions and community rating requirements, essential health benefits and community rating will remain in law, but states can apply for a waiver if they have a high-risk pool. A high-risk pool is you take all the people who are not healthy and who have pre-existing conditions or chronic conditions, and you put them in a separate pool with taxpayer-subsidized coverage, so we take care of those people, and that lowers premiums for everybody else who's healthy because they're not expensive to insure. So if you can do that, if you can create that situation, then you do solve that problem.
Okay, so what do you make of Speaker Ryan saying, as many others have, that it is important for tax reform, which is supposed to be their next big thing they're going to get done, much easier if they get health care reform done first, and they may vote as early as next week, according to another member?
Well, it's two reasons why passing health care reform is important to tax reform. Number one is momentum. That politics is like sports. It's a game of momentum. And if you don't have momentum, then it's hard to score the next goal, right? So the failure to pass Obamacare was a momentum killer for the Republicans, and it made it much harder to pass everything else. If they can get this done, they can get their momentum back. And second thing is an issue of revenues. So there are $1 trillion in Obamacare taxes that have to be repealed in the House bill. You need that repeal to be able to do tax reform, because if you don't have it, it makes tax reform much more expensive to do. So they need to do Obamacare. The reason they took on Obamacare first was because they needed to do that to lower the baseline so that they could get tax reform done.
All right, literally just yes or no, do they vote on this next week?
No. Well, they shouldn't.
We'll put you down for no, and we'll watch and see as they finally come back to town, to Washington, to get to work. Marc Thiessen.